So this is a, thank you friends, this is a new concept of doing the chopping, to have a very innovative instrument to chop the hard cataract. This is a line chopper. So frankly speaking, the chopping technique came in action after 1993 in ACRS when the Nagaharas developed this technique, and after that there are so many techniques evolved: Nagahara chop, stop and chop, pop and chop, bimill chop, quick chop, pre-chop, tilt chop, and patella chop, of course, today I am seeing. So this is another level of align chopping, align chop. So basically the chopping techniques is involved in the two parts, horizontal or vertical. The all chopping techniques, manual instruments are used replacing the ultrasound power to get the efficiency, safety, and reduce stress on the zonular bed. It is purely kinesthetic. In hard cataract, there is no need of red reflex dealing with the mature cataracts. And of course, chopping is good for when your pupil is small in size, with 2 to 3 millimeter of the pupillary zone, you can do the chopping also. So these are the horizontal choppers, they are the vertical choppers, and this is the three-dimensional 3D chopper. Just see this carefully, what the design actually is. Blunt at the tip, 1.5 or 2 millimeter long, bend is as 30 to 40 degree, 2 millimeters away from the blade. It is 26 gauge shaft. So for the left hand surgeon, the bend is towards the left side, and the right hand surgeon with the right side. So this is basically the bend of 30 degree or 40 degree. So accordingly, you have to make the second incision from the primary incision. Either you have to place your incision 30 degree away from the main incision. So just see this. This is a brown hard cataract, and you are holding it going from the periphery, and you have to insert the chopper along the line of the axis. You see it, you are clear cut, you are chopping it from the periphery to the center, holding again from the center, under the axis, go to the periphery, and chop towards the center in the alignment of the axis of the tip. So this is the basic concept. So that's why the nucleus during the chopping doesn't rotate. It almost of the time when you hold the nucleus and you are going to chop it, it rotates on the axis of the phaco tip. So in this instrument, basically it is from the periphery to the center. This is aligned towards the tip, so it doesn't allow the nucleus to rotate on its own axis. So the more you chop, the more are the segments, and the more are the segments, less power is utilized in phacoemulsification. So this is how the align chopper works. It is tilted, and it does the lateral separation also. And you see this, again, a video. Good rhexis is there. Hydrodissection precision, a small crater is made in this case. And after making this small crater, just hold in the center. The crater is from paracentral to the central side. Hold it carefully and take your instrument towards the edge, toward the equator of the lens, and chop it. Just see this. It chops directly from anterior to the center, and behind this, the tip, it is crack. So they are the two things they are involved in these techniques. The one is the chopping, and second is the cracking. So anteriorly it is chopped by the blade, and posteriorly it is cracked. And you can use this instrument as well for the grade 2 and grade 3 cataracts. Of course, they are the soft cataracts, so you can use them. Hold it in the center and chop it. And the lateral separation is also done very carefully. And the rotation of the nucleus is also done, it facilitated because it is, a little angled. So, and the rotation of the nucleus is also facilitated by this. Chop it again. And push the segment towards the tip by this, and eat easily. Soft cataracts is very easy to deal, and if they are very white cataracts, after doing a good access, hold it in the center. If it is possible, with a high vacuum, go it and hold it with a high vacuum, take it towards from the periphery, come towards the tip, again it chops. And the lateral separation is done from anterior to posteriorly. This is how it is done. And if you are definitely a femtocataract surgeon, take out the button. You see is here. And the gentle hydrodissection is done to take out all the vacuoles, air bubbles from within. Just see the first video, your left one. Bubbles, and just gentle pressure is given to take out the bubbles. Little gentle rotation is done so that the bubbles, they come out. Take your phaco, go in, and along the course of the chopper you go inside, hold it. Already the fine pieces has been done. So you have to select where to hold. See the notch, you have to, and just separate it. And this is how it is. And then after, everything is very easy to take it out. So this is the magic of a small instrument. You can just change your instrument, whatever the instrument you are using, chopper, just tilt a little 30 degree, it will be aligned chopping. Thank you so much.
Sir, I think it's a very good idea. The idea did cross my mind, but I didn't know how to translate that idea to the manufacturer. What should I say? But this is a very good idea, I think. The nucleus will not rotate with this.
Basically, so it prevents rotation actually on the axis. Hard cataract that always rotates when you just try to chop it. So that becomes difficult. If there is posterior tear, then the rotation that creates again a problem to you. So it is better to stabilize your hard nucleus inside the back. That is more important. So this instrument stabilizes all the equation inside the back. Thank you.
And
Yes, it is with the Pericon. Pericon people, they are manufacturing.
Precon.
Pericon. Jen Metalworks, Jodhpur.
Precon Surgicals.
Pericon Surgicals. I will send one instrument to you. No problem. I have your address.
sir, me too.
Thank you so much. I will send it to you. I have lot of
So
choppers with me.
can we take the next
My
talk?
mobile number is My mobile number is 8191084152. So you can just.
Uttar
I'm based in
he's
Agra.
Lucknow, Agra, हाँ, Dharmendra
Yes,
Nath.